Thank you very much, Paolo, for this kind introduction. And I would like to thank Canon Medical for this opportunity to present the novel ultrasound tools for the pregnancy evaluation. And this is a great honor for me to share our experience with you today. And our ability to assess pregnancy was really revolutionized with the introduction to the clinical practice with this new ultrasound probe, as you can see here. This is I8C61, which is the combination of the two transducers that we used to have. And this probe allows us to achieve absolutely amazing visualization, and all the pictures that you're going to see today, most of them, they are obtained using this technology. And I think that by the end of this presentation, you will be convinced that you absolutely need to have in your clinic ultrasound machine by Canon, including this probe. And as usual, our ultrasound evaluation, the most commonly, we look at the fetus in the second and the third trimester, and this is just to demonstrate how crisp and detailed our ultrasound image is. Then we apply Canon technology for the evaluation of this fetus in the second and the third trimester. But also, as you heard very clearly during the lunch symposium, our ability to evaluate fetal anatomy is also very substantial in the first trimester. And you can see that this is the protocol that we use in our clinic for early assessment of the fetal anatomy. And this is also done according to the latest guideline from the ESOC that we need to attempt to assess the early anatomy of the fetus. And here you can see the typical views that we can obtain and the quality of those views. And this is the fetus and the 13 weeks of pregnancy. They are pretty much the same like we can obtain at the second trimester because of the resolution of the high frequency probes that we have now. How about the diagnosis of the fetal anomalies? And here we have the very abnormal cortical development, and without that resolution and without the technology that allows us to differentiate the details and very tiny details of the development brain, we probably won't be able to diagnose that, and this is critical for the management of this pregnancy. Here we have another example, and this is the image that shows you how different structures and how different tissues can be determined by the new technologies. So we have the significant pleural effusion, we have the chest mass, we have the differentiation of the compressed lung tissue here and the cardiac structures. And you can see that the way how we can see the details and the properties on the different structures on the 2D, it's pretty amazing. So how about color? Assessment of the blood flow, it's very important in our everyday practice. And as you know, for the second trimester screening evaluation of the heart, now ESOC recommends to be familiar with the color Doppler settings, and this is optional to use during even the screening evaluation of the heart. And we have the very old and very loved tool, which called the advanced dynamic flow, that allows us to evaluate and assess blood flow, the structures of the heart and the vessels, and you can see that the intracardiac flows and the flows in the pulmonary circulation can be easily assessed because this technology allows us the accurate detection of the blood flow and a reduction of the artifacts. So also it's very important that then you apply color technique that the quality of the 2D image doesn't change. And here we can see the upper mediastinum where we can recognize very clearly the trachea and the lungs, and we can recognize the vascular structures. We see the left brachiocephalic vein, we can see the head and neck vessels of the aorta, but see how well the thymus is defined here. And this is pretty amazing that the application of the color Doppler, we have no bleeding artifacts and we still maintain a very good resolution at the 2D image as well. But this is not it. So we have another amazing technology that's called the superb microvascular imaging, or SMI, that specifically developed for looking at the low velocity flow. And here we have certain parameters that allowed us to see that the high resolution low velocity blood flows, and we will see how amazing this technique helps us with diagnosis. So this is just to compare the SMI with ADF, and usually assessment of the blood vessels at the level of the upper abdominal circumference. This is the very highly vasculature area where we have the vascularization of the liver. As you can see, liver has a lot of blood supply, and it's arterial. This is portal. This is the blood from the umbilical vein, and this is the ADF image. Looks pretty good if you look at that beautiful portal sinus here. But if we apply SMI, we can see much more details, and we can recognize that the very good quality all those vascular structures that can be very helpful the diagnosis of the anomalies of the venous flow. And just to add, we can use the different maps. We can use the color map for SMI, but we also can use that map that allows us to suppress the background of the 2D image. And this technology looks almost like the contrast imaging that we can see in adults. And that's why sometimes it's also considered like the contrast imaging on the fetal assessment. How about the vessels of the brain? We all know that the evaluation of the brain structures, and in particular of the corpus callosum, is very important for diagnosis. And you can see the resolution of the 2D image, a beautiful image of the corpus callosum, cavum, septum pellucidum. And also the SMI allows us to highlight not just the pericallosal artery and vein of Galen, but also numerous vessels and branches of those vascular structures that could be also of diagnostic importance. Another area where we can see the vasculature and assess the microvessels, this is the baby's kidneys. And here you can see that evaluation of the renal vessels, this is a very important indicator. Then we are looking for the anomalies of the kidneys. Very often we can see the accessory renal vessels. And the fact that you are not able to visualize renal vessels can also trigger the diagnosis of bilateral renal agenesis or unilateral renal agenesis. So the vasculature of the renal tissue, this is important for diagnosis too. How about the pulmonary veins and the pulmonary circulation? Here is the good example, allowing us to evaluate not just the immediate branches of the pulmonary veins which are connected to the left atrium, but also the peripheral vasculature of the lungs that is also very well highlighted using SMI. But SMI has a very interesting and unique property. As we said, it's designed for the really low velocities, and as soon as we have the movement of the blood, or the movement of the myocardium, so that because it's a low velocity, in the third trimester, if we scan the third trimester heart, we can see that very often the visualization of the cardiac structures is limited due to the extra shadowing and difficult position of the fetus. So use of SMI in the third trimester in particular, and especially in the very difficult patients with increased BMI, can help us to highlight the borders of the heart. And even in the first and the second trimester, SMI shows us the blood flow in the third trimester and can help us to navigate where the movement of the muscle is and where the muscle is. So the visualization of the myocardium in the third trimester is possible by SMI. And just because the cardiac imaging is definitely my passion, I want to show you that that there are several probes available for comprehensive cardiac imaging. And the first one that we already talked about, this is I8C X1, And you can see that this is the very beautiful image of the chest of the fetus in the second trimester, the beautiful visualization of the cardiac chambers and very good delineation of the borders of the myocardium. And here is the image obtained by the phase array cardiac probe. And for me as a cardiologist, this image looks closer to my heart, and because it's more grainy, but this is what the cardiologists get used to, so that the tools that are available on the Canon machine for the cardiac evaluation can actually satisfy not just the cardiologist, but the pediatric specialist and MFM. And I think that if we will take the survey, so the MFM would prefer this image and the cardiologist definitely this one. So that means that everybody can be happy. And of course, evaluation of the blood flow, it's an important part. And here we have ability to look at the intracardiac flow using the color Doppler. We can use the ADF to visualize better the velocities and circulation in the pulmonary veins. And also we can use the SMI to better visualize the interventricular septum and the crux of the heart. And so that shows us that we have a very different tools that can serve us to look at the different aspects of the blood flow, the heart. We can also look at the spectral Doppler, and spectral Doppler is the optional technique then we are evaluating heart, especially if we are doing fetal echocardiography. But I would like to show you that also this is a very good technique, and this is presented here for the cardiac rhythm evaluation, where we can see simultaneously the blood flow in the pulmonary veins and the pulmonary artery. And this is technique which is proposed by Dr. Carvalho from Great Britain and can be easily achieved using a Canon machine. So a little bit of anomalies. We were looking at the normal heart, but now we are going to take a look at the anomalies. So the diagnosis of the congenital cardiac anomalies is easy. The Canon machine I-series, and here we have the 4-chamber view, our typical screening view on the fetus in a bridge presentation. It's pretty obvious that the cardiac axis is deviated to the left, that the image of the descending thoracic aorta is located on the right. From the midline in the chest, we already suspecting that there should be something wrong with this heart, and indeed it's something wrong. And here we see the left ventricle outflow tract showing the vessel that overrides the septum, and the color Doppler confirms that that vessel actually receives blood from both ventricles, right and the left. And the 3-vessel and trachea view clearly demonstrates here that there is a right-sided aortic arch, right-sided ductus arteriosus, the significant narrowing of the pulmonary artery, which is consistent with the tetralogy of Fallot, the right-sided aortic arch. And we know for sure that that fetus, because of these findings, in a high risk for DiGeorge syndrome. How about the comprehensive evaluation of the cardiac anatomy in the first trimester? Here there is a fetus at 16 weeks gestation, and we can use SMI technology to look at the blood flows, look how big the atrial appendages are in the first trimester. This is very typical. And also we have a very nice image and delineation of the interventricular septum. And again, this is 13 weeks gestation. Assessment of the vascular structures in the first trimester also is very achievable using our technology. And here we have the image, again, very similar that we saw a few minutes ago, but this is in the first trimester. We have the stomach here, and we can assess the entire portal vein system here and umbilical vein, which is very important for situs evaluation. And here is the sagittal view demonstrating the aorta, and hepatic veins and the course of the ductus venosus. So, and again, this is the image in the fetus about 13 weeks gestation. So this is pretty amazing because it seems that the diagnosis is going to move more and more to the early diagnosis of the anomalies. So these technologies, I believe, will be very important for us in the future. So how about the cardiac function? Cardiac function, as you see at this congress, is the flavor of the season. So a lot of talks and scientific papers are related to the comprehensive cardiac function evaluation. And Canon machine has a lot of tools to offer. And here you can see the technique for assessment of the TAPS, or systolic excursion of the tricuspid valve annulus, and this is a technique that allows us to evaluate systolic longitudinal function of the right ventricle, which is a very important tool for the assessment of the functional state of the baby's heart. But using the cardiac probe, we also have an access to the latest technologies, such as the tissue Doppler. And here you have the image of the color tissue Doppler and the spectral tissue Doppler. And this is just to demonstrate how much information you can get from just one single sweep of the tissue Doppler. We have the information about the velocities, and the velocity during systole shows us and characterize the systolic function. We can assess the diastolic function, and here is the velocity and movement of the myocardium during early diastole. This is during atrial contraction, but also we can evaluate every single part of the cardiac cycle. We can look at the injection phase, at the isovolumetric relaxation time, at the time that the early diastole take, the time that the atrial contraction takes, and also we can evaluate the isovolumetric contraction time. So this imaging and this time interval assessment could be very important for the cardiac evaluation, the cardiac function, as well as for assessment for the fetal arrhythmia. A little bit abnormalities. So here is the example of the chest mass, the pericardial and the pleural infusion. And you can see that we used SMI just to highlight the heart. We can see that this heart is compressed, in particular the left side of the heart is compressed, which is pretty evident at the trace obtained from the left ventricle. And because the left ventricle can relax appropriately, so the right ventricle have to take over. And you can see that the feeling of the right ventricle is significantly increased, and this is shown in the increased movement of the myocardial during atrial contraction. So our technologies are very important for the vascular anomalies, and here we can make easy the diagnosis, differential diagnosis of the thoracic lesions. So this is the big echogenic mass, and we can visualize the feeding vessel that raises from the aorta. So this is the evidence of the systemic supply, and that makes this lesion the pulmonary sequestration. And you can see how easy the differential diagnosis is, and we use these technologies, which is usually quite challenging, and you're always debating if it's the CCAM or this is the pulmonary sequestration. So this is another very interesting case. So this is just a still image, and if you look at this very briefly, you feel like, okay, head is kind of close to the placenta and you can move on. But if you take the clip, you can see that this kind of placenta thing is actually moving together the baby's head. And if you apply all the techniques that we have, we can visualize that indeed this tissue belongs to the baby's head, and this is the big subcutaneous solid mass, and that has this vascularization that originates from the vessels of the baby's head and neck. And then we apply SMI. We can see that this is highly vascularized tissue, and this is consistent with hemangioma. So, but by now we talked about the very well-known technologies, and I think that lately the horizons of the assessment, not just the structures, but the physical properties of the different tissues, including the fetus, got significantly broadened for us. And this is the intensity analysis, and this is the specific technique, very unique for Canon, that allows us to assess the tissue homogeneity. And in the adult imaging, it could be very important for the liver evaluation, and this is technique applied here for the fetal liver as well. And we can see that we can evaluate how homogeneous the tissue of the liver is, and you know that in the fetus from diabetic mothers that could be different, and this is probably a very interesting area for research. So we can actually compare the measurement because it's quantitative, and we can compare different areas within the liver and see that the liver is homogeneous, and you can see that we use the values, then we compare the tissue to the normal kind of hypothetical ideal tissue that the relay law works there, so that we can see and compare how homogeneous is the tissue that you're looking at in comparison to the ideal tissue. And this is very typical values for the adults and children liver, and the same on the fetus. Here is our example, the pulmonary sequestration. You can see that the sequestration is more homogeneous, and this is the value. And the important thing that it's quantitative. So you not just look at the picture and subjectively judge it. You have actually the number that allows you to tell for sure, yes, this is more homogeneous, this is less homogeneous. You can compare the homogeneity of the liver, the homogeneity of the spleen, and ideally it's supposed to be the same. You can take the ratio between those measurements, and it's hard to tell how that can be applied, but probably research is needed, and this opens the door for a lot of research in different pathologies such as IUGR or diabetes that would allow us to answer the question if there is any changes, like structural changes in the liver, that we can measure on the fetus. And we are moving to another exciting technique. To understand this technique, you need to remember the basics and physics of ultrasound. And here you can see the interaction of the sound wave with the tissue, that some of the energy can absorb, and some of this energy will reflect and transmit it further, and then some of this energy will be lost. So we have the attenuation analysis, which is assessment of how weak the signal is going to get through, then it penetrates through the tissue, and this is the normal values that were obtained. So we can evaluate the attenuation, for example, in the fetal liver, and you can see that this is a normal value which is also observed in children. So again, a lot of potential in this technique, and I will show you later that it can actually revolutionize our understanding and our way to look at the structure of different tissues. So, and here a few words about the research that we are doing. So, looking at all the technologies and varieties of the methods the Canon machine can offer, it's no wonder that we decided to partner with Canon and in the past Toshiba to help us with the NIH Human Placenta Project. This is the project that was launched by American National Institute of Health, and 19 grants were awarded, and we were the lucky winners to have one of those grants. And we are looking at the different aspects of the placenta. As you know, that the alteration of placental development can result in abnormality in placental biometry, tissue properties, and tissue density. We can see calcifications, and we can see the abnormalities of the vasculature. So all those aspects of abnormal development of the placenta can be easily evaluated using the present Canon technologies. So here is the placenta in the first trimester, and you can see that in 2D image we can clearly differentiate the different placental structures, including the presence of the lacunae, the placental mass. We can easily identify the cord insertion, which is very important for that management of this pregnancy. Of course, evaluation of the placental vasculature could be achieved using the SMI technology, and regardless of the map that you're using, you can identify pretty much every single vessel within the placenta. we can assess the blood flow in the smaller vessel, and here you can see the example of the vessels from the maternal surface of the placenta and from the fetal surface of the placenta, and the typical pattern of the blood flow that can be identified by very, very sensitive spectral Doppler technique. And so this is quantitative, so we can assess the pulsatility index and the parameters of the blood flow, the thing that teeny tiny vessels that the SMI allows us to identify. We also can apply the vascular index to have a better judgment of the vascularization of the placenta. And again, important thing that this is the quantitative analysis. So you get the number that you can then compare, and potentially you can develop the normal range, and that can make the observation more objective. And of course, we didn't talk much about that, but Toshiba has, the Canon, sorry, takes time to adjust, has amazing 3D technology, and here you can see the 3D reconstruction of the vessels, the placenta. Another unique technique allowing us to take a look at the placenta and see presence of the calcifications. As you know, if you do the breast imaging, the presence of the microcalcifications could be very important clinical predictors. So here you can see how those calcifications can be found and clearly visualized the placenta. So this is a normal placenta. We can see a little bit of calcifications, the maternal abdominal wall, and this is a true calcification, the placenta. So another very important technique that can be applied specifically to the placenta, this is the shear wave elastography. This technique allows us to send a very short push pulse to the placenta, causing the tissue displacement, and then the displacement will generate the lateral shear waves that would propagate, and we can evaluate the propagation velocity. We can also get measurements, and that measurements would tell us very important properties of the placenta, such as elasticity. And here you can see the typical image of the placenta, the shear wave elastography applied, and here we have the values in the velocities, but also we can use the quad view, and that quad view is very important because it allows us to see not just velocities and the kilopascals, but also allows us to assess the dispersion. And as you can take a look at the report, and this is the data obtained the day before I left for this conference. So this is one of our patients from our study, 13 weeks gestation, and you can see that from that early stage you have a lot of quantitative information allowing you to take a look at the speed, at elasticity and dispersion. So we probably need to learn a lot how to use this data and what's going to be the most clinically relevant, but this is very promising tool, and again, this is quantitative analysis. How about intensity analysis of the human placenta? You can see that usually human placenta, the same like the liver, supposed to be very homogeneous, and again, we can judge it like using those numbers. You can assess the homogeneity of the placenta as the whole organ. Then you use the trace technique, and again, this is very useful for us in our study. This technique works in contrast to shear elastography that has some limitations on the depth that you can penetrate probably up to 6 centimeters deep. The intensity analysis actually can be easily applied to the anterior placenta or posterior placenta, or works pretty well at any location of the placenta. And the progression of the pregnancy, you can clearly see looking at this map that the placenta gets more heterogeneous, and that can be measured. And finally, attenuation analysis also can be applied for the placental evaluation. And here you can see the example showing the normal placental property, that's again homogeneity of the placenta in the mid-second trimester. So in conclusion, what are the advantages of the Canon technologies and what this machine can offer you for your research in the clinical practice? First of all, it's the comprehensive evaluation of the fetus and the placenta in real time, starting very early in gestation. It's very easy to apply, and again, easy apply in the mid-trimester and in early gestation. This technology allows the quantitative assessment of the placental structure and vasculature. It allows detailed cardiac evaluation, including comprehensive cardiac function assessment and early echocardiography. And what's the most important, that the technologies of Canon, they continue to evolve and the new applications appearing very often, so stay tuned. And I would like to thank you for your attention. And I think that these amazing technologies from Canon, we can have a very detailed look in the future. And I hope that soon we will report the results of our placenta project here. Thank you very much.